If they're retiring and they're only going to live off their Social Security, then you got to see how much how much that is, and then what their expenses are going to be. They might not be able to afford, the $150 plus, the $300-400 worth of that, and this would be a better suited plan. If they're traveling, sometimes it's better to go to the supplement if they live in 2 different states. If they're not, if they're seeing the same doctor and they don't plan on doing anything and moving, and sometimes the Advantage is a little bit better. But it's really looking at all the options and then figuring out what's best. Additional considerations, special needs. If they have chronic pain, if there's something wrong, so it's always good to ask health questions just to see where they are physically, because there's some plans made for other people. So in Arizona, there's about 100 plus different Medicare Advantage plans available, and each one is different for people depending on their health assessment, income, their health assessment, what they need. Some need some dental, some need some back pain, some need some medication, some need some caregiving. So depending on what they need, there's generally a plan for that. If they're low income and they're eligible for state Medicaid, there's a plan specific for that. If they're high income, and then they can have pretty much any plan they want. And so this covers the Medicaid assistance. So always see what their income level is. If it's below $1,200, they qualify for full income, full Medicaid, and then they can get a Medicaid plan. So then once they get enrolled on that, Access their secondary, so pays all their co-payments from the Advantage plan. Generally, if you're on Access, there's no point in having a supplement plan because Access is your secondary payer. So it's kind of like having a supplement without paying for it. Financial assistance, Medicaid does cover that. There is low income subsidy, which does cover drugs. So it gives some extra help for drugs. So if their income is generally below $1,600, they can apply for one of those two, low income subsidy or Medicaid. The LIS low income subsidy will cover their prescription drug costs. If they don't qualify for Medicaid, but they get their drugs covered. If they qualify for full Medicaid, they get everything covered. And then there's an in-between LIS and full Medicaid. It's just Access, and they just cover the Part B premium. So if you're under like $1,700, $1,500 single, then you can get at least your Part B paid for, the $185, and then you go on Advantage, so then you do that. There are plans that do cover the Part B. So enrolling in Medicare, when you're turning 65, you have 3 months before your 61st birthday, and then 3 months after, and your birth month. So 7 months total to pick a plan. If you're on Social Security, going into that, they'll issue your card, and then once you have your card, you can put them on a plan, and the plan will start the first day of their birth month. If they go past that, then it starts the first of the following month. If it's on their birth month, if you sign them up on their birth month and it's the end, then it's the first of the following month. So if they miss that, then they gotta wait. Then you gotta wait till open enrollment. So that's a general enrollment period when you're signing somebody up for Medicare the first time.
How long is open enrollment?
So annual open enrollment is 3 months at the end of the year. General open enrollment, your initial open enrollment is 7 months. So when you meet somebody turning 65, they have, like I'm born in April, so I have 3 months before April to find a plan and 3 months after April to find a plan. If you're going on the supplement open enrollment, so that's Medicare Advantage and Part D plans. The supplement enrollment, once you turn 65, you have your birth month, and then 5 months after to get on a supplement plan for a guaranteed issue. So supplement plans are medically underwritten, which means if you want one, they're just straight insurance. They're not Medicare, they're not contracted with Medicare, you pay them and they cover your bills. So if you're sick, you can't get one. Unless you're turning 65, then you have a guaranteed issue 6 month window to get on a plan without underwriting.